Monkeypox is spreading, and the first case in the U.S. came in May. Now there are at least 460 confirmed cases.
And 90 of them are in New York. And there's a new warning headlined, "It's time to raise the alarm on monkeypox."
And it comes from Syra Madad, who is in charge of handling special pathogens, special diseases-causing organisms at the New York City Health and Hospitals Corporation.
So, Syra, thank you so much for joining us here on the Pix 11 Morning News.
Morning. Thank you for having me on.
Yeah, so your doctorate is in health science, and you've been heavily involved in the city's response to coronavirus. So tell us why you think that we need to raise the alarm about monkeypox.
Well, anytime the virus is acting unusually or behaving unusually, that's when we know it's not only very concerning, but we need to make sure that we're doing everything we can to contain the virus. When we talk about the monkeypox outbreak, it's endemic in, Central and, Western Africa, and we've never seen it explode to this extent outside of those endemic countries. So here in the United States, as you've mentioned, we have nearly 500 cases, and that's just as of last week. So we know the case counts are very high. Outside of the U.S., there's over nearly 6,000 cases reported in over 50 countries. And again, we know that's probably an underestimate as well. So what's very unusual in this current outbreak is that you're seeing more and more cases among humans. Usually it's animals to humans. Now we're seeing humans to humans. So the virus is certainly behaving unusually. It's concentrated in the community of men that have sex with men, but other cases in women have been detected here in the U.S. and other countries. Handful of countries are also reporting cases in children, and so that's certainly very concerning. I think when we talk about the current epidemic, what's really important is that we try to contain this virus as much as possible, and that window of containing the virus is certainly getting smaller and smaller. It's not to say that we shouldn't do all of our efforts now, even though that window is getting smaller. We need to just make sure we're doing more of it. And what this means is that we're expanding and making testing more available. The Biden administration has mentioned that they're getting more testing online, so that way we can test more people that have any unusual symptoms or any unknown explained rashes. We need to make sure we have vaccines available, broadening the eligibility. We have good risk communication. So all these things need to happen very fast so we can try to contain the virus and get a lid on it.
Now, before we get too far, Doctor, explain to us exactly what monkeypox is and what level of danger it represents to the public.
So monkeypox first is not a new virus. When we talk about COVID-19, that was completely a novel virus that we've never seen before. With monkeypox, it's been around, the first human case was detected in the 1970s. So we have a lot of research and knowledge that we can go back to. We also have therapeutics and we have vaccines available for it. So we're not starting from square one. And so when we talk about monkeypox, it is a self-limiting disease, meaning that many people don't even require hospitalization. Some people may have, monkeypox and not know it because, the rashes or the lesions are pretty, either confined to a region of the body, or it's not concerning to them. Oh. So in that regard, it's a good news that it's not causing, debilitating, symptoms or causing people to certainly, require hospitalization. At the same time, we don't want anybody to get this virus because there could be certainly other complications associated with it. You can spread the virus to others through close contact or through contact through contaminated objects and the like. And we're very concerned if individuals that are immunocompromised, women that are pregnant, children get it because they tend to not do well with monkeypox. In addition, there's also concern of it going into the animal population and basically becoming endemic in other countries that this country certainly, this virus is not endemic in. And so there's concerns on that. So I think when we talk about, this virus, not new, we have the tools, but at the same time, we want to make sure that we are trying everything we can to ensure that this virus does not continue to spread. We're breaking chains of transmission, and we're doing a good job of educating people what to look out for.
Now, you speak about tools, and you mentioned a vaccine. The Manhattan Borough president has said that the city will be getting about 10,000 doses of monkeypox vaccine in a federal distribution plan. Do you think that's enough?
Yeah, it's certainly not enough, especially if you're looking at the entire population just here in New York City, as well as, in the United States. By the end of the year, we're seeing maybe about, 1.6 million vaccines available. That's a drop in the bucket, to be very honest. And it's not just a vaccine-only strategy. We want to make sure we're preventing infection from even happening. And so that's why we need to do a much better job in just the communication of what is this virus, who's at risk, what should you do to prevent this virus from spreading, how do you prevent it from you contracting it? And so we need to rely on all these different tools that we have certainly vaccines is really important, and we're not unfortunately going to have enough of it. It's still in limited supply now, and it's probably going to continue to be in limited supply by the end of the year. We want to make sure we're building on these layers, and we know about these layers, right, because of the COVID-19 pandemic. And so when we talk about monkeypox, these layers are similar but a little bit different. So making sure people understand how to prevent themselves from getting this virus.
Now, as you said, so far monkeypox has been most prevalent among gay men, and we know that's sort of the way the AIDS epidemic started. We did fail to respond to that appropriately. So how do we avoid making the same mistake this time?
That's an excellent question. It's really important that we avoid stigma, discrimination, or marginalization of any community, because first, monkeypox is not a gay disease. Anybody can get it, whether you're a man, you're a male, a female, a child. Doesn't matter your age, your gender, your sexual orientation, the sexual orientation of your partner. And so first, what we know is that monkeypox typically is not a sexually transmitted disease, but it is, presenting itself in a very atypical way. There's investigation ongoing of, is it transmitted sexually? But because of the close contact of, just having that particular activity, that's where it may be, likely being spread. And so really important that we understand that the community that's most at risk is the community of men that have sex with men. But at the same time, anybody can get it. And so we need to do outreach for all communities.
Yeah, education is clearly key. Yeah. Syra Madad, thank you so much for joining us this morning and giving us all this very important information. We appreciate your time.
Thank you very much, Doctor.